Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Thanks very much. Hi, everybody, and welcome to our Thursday Community Service Program. Today is Muenster Memorial Hospital Day on the program. Very happy to have a guest we have not had before, and I've been excited about this ever since I found out that Janette Grewing was going to be with us. See, I almost called you Janet, too. Janette Grewing, Director of Muenster Memorial Hospital Home Health, is here. How are you?
I'm good, thank you.
It's good to have you here, and I've been excited because I like a challenge. I was told all how nervous you were and how all of this about being on the radio, and I thought, I'll settle her down. I'll take care of her. It's just you and me, girl. Let's do this thing. I'm excited to learn about you because I know you haven't been, you're relatively new, I guess, to MMH Home Health. So tell us a little bit about that.
I am. I started January 4th this year, so I'm right at 6 months in. I came from working in hospice and home health for several years. I have some background in the hospital working OB as well. Mm-hmm. I contemplated applying for the job for several months and watched a lot of people go in and out and thought, oh no, I'm not going to do that. It's not for me. And finally just decided I wanted to be close to home. I was tired of driving, a long way every day and taking care of people in a lot of other communities. When I get to take care of people close to home, that's what makes the biggest difference to me. And felt like it was a good opportunity for me.
And when you went through school and you got your degree and you're a registered nurse now, were you ever looking to be in any sort of administration at all at that point?
Absolutely not.
That's what almost all nurses tell me. Never. And so what about it appealed to you? Just maybe a chance to bring some stability to the position or what?
Well, as a nurse, when you first are graduating school, you think, I don't want to be involved in the politics. I just want to be a nurse and take care of my patients. Mm-hmm. And that's your first priority. But the truth is, no matter where you're at or what you're doing, you have to be involved in the politics. Mm-hmm. It's just part of it. It's part of healthcare today. You get pulled in no matter what. This was an opportunity for me to actually be a leader, to make a difference, to make a change. Mm-hmm. I live in Muenster. I plan on living there for a long time, and I want to know that the healthcare's there when we need it. My entire family's there. Mm-hmm. And I saw some of the trouble that the hospital district was facing. I didn't know a whole lot about it being on the outside, but I saw a challenge, and I wanted a chance to do my part to fix it. So
I love hearing that. You're my type of person. Now, what about, I know you live in Muenster, you have family there. What are your actual ties to the community?
Well, I was actually born in Muenster Hospital. So was my husband. I went to school in Era from first grade on, kindergarten in Forsberg. My mom's family grew up in the Roston area. My great-grandmother was the postmaster out there for years and years. Mm-hmm. My dad's family grew up in the Callisburg, Walnut Bend area. But I married a man who is Muenster through and through. He's related to probably everyone in that town.
Isn't everyone related to everyone in that town?
Yes,
okay.
They are.
All right.
Yes, they are. And he's been there his whole life. His mom started the home care, and his grandmother was actually one of the first nurses in the hospital, Lulu Hess. So, we just finished our home there in December, and we're raising 4 boys there. He owns a business in town. This is kind of, where we're going to be.
That's where your roots are right now. That's good. That's good. And that's wonderful because to me, it seems like it always means a little more when you're doing something for your own community. Like you said, you worked on the road for a good while, and now just coming home and contributing to the community in some way is always good, whether it's through volunteer service or your work. And I know it's important to you to be there, and I'm glad to have you there, and glad things you're happy with the way things are running, no doubt, in home health. Seems like it's clicking right along.
We have made a lot of changes since January. I mean, very, very substantial. It has been a challenge. We still have lots of challenges ahead of us as healthcare continues to change. But yes, I feel like so far it is going well. The upper management has been good about making sure we have what we need in order to put those changes in place. And we're just moving right along.
Now, it's more than just Muenster because Muenster Memorial Hospital Home Health serves people outside of Muenster as well, don't you?
We do. We serve all of Cook and Montague counties. So as long as someone falls in that boundary, we try to service them. We always look at our available staff as well as their needs to make sure that we can meet them, but we definitely try not to turn anyone away.
And let's talk about staff, because I know in most all areas of healthcare, staffing is one of the biggest problems you have, and I can imagine in home health it's the same way, especially in a small community. Talk about your staff.
Our staff right now consists of Diana Stockard is our longest employee. She's one of our LVNs. She also works in doing some of our marketing, community relations. Tammy Pierce is our RN case manager. We also have Helen Lewis is a PRN RN for us. And we have a new staff member, Kristen Burgess, who does our billing. And Stephanie Rocha is another LVN that came actually out of the hospital to join us. She'd been in home care for a couple months previously, and it just wasn't working for her, and we kind of stole her away from the hospital to come work with us again, and she's great. The patients love her. She's a local girl too, so
and for those
makes a difference.
For those that may not be aware of this, you just recently, in the last couple of months, moved into a new office that's actually off campus, right?
We are. We moved to 208 Walnut Street. They were looking at possibly putting in the specialty clinic, and they needed that space. It was connected to the family health clinic, so it makes sense to keep them together. And we're kind of a small team, so we don't need a whole lot of space, especially with our new computer software and our electronic health record. Our clinicians are able to document in the field and in the home, so they don't require the same amount of space. So yeah, we found us a smaller office. It's small, but it's definitely nice. Not too far away.
Yeah, and I know that it's a little more comfortable. And although you don't need a lot of space, I think once you move and get away from campus, it seems like you've expanded no matter what your space is, doesn't it?
We have definitely expanded. We've been very blessed. We've not really tried to grow a whole lot at this point. One of my goals was to make sure that everything was in place to be sure we could give the very best possible care and follow, all of our rules and regulations. But along with that, as we've made substantial improvements, we have grown. And our staff continues to grow, and so does our patient census. So we're very excited about that.
You brought up goals, so I know you probably have a list as long as your arm, but what are some of your goals for MMH Home Health?
My first goal is absolutely to be a patient advocate. I always want to make sure the patient is taken care of. That should be first, no matter what. My second goal to prioritize would be to make sure that we are following, all the Medicare conditions of participation, state and federal regulations, making sure we're doing things the way they're supposed to be done. It's very important. And the third thing is I want to contribute and make sure that we help the hospital district with our financial stability. It's a treacherous road we're traveling down, anyone in healthcare is, but especially being in a rural area. And I just want to make sure we're doing everything that we can to maximize our potential and help contribute to the district.
And it's so important. Some people may not say this, or at least would not admit this. You don't know how lucky, but a lot of people don't know how lucky we are to have good hospitals and medical services in our rural communities like Gainesville and Muenster. There are more than not that don't have that have to drive forever to get anything, and that some areas there is no home health to serve. So we're very fortunate, very lucky here to have that opportunity. And I know it's a struggle, and I know that the hospital has to offer expanded or extended services in order to be viable these days. And home health is certainly one of those. We're out of time, Janette, but let me tell you something. You did great, and you're welcome to come back here tomorrow if you want to, and do this again, or
thank you,
or anytime Gayla lines you up to bring you in. That'll be great. Okay.
All right. Thank you so much.
Thanks so much, Janette. Janette Grewing. She is the director of the Muenster Memorial Hospital Home Health. And that'll do it for our MMH program here this month on Hometown Radio, 1580 KGAF.